Hi there. We'll be talking today about plastic surgery or cosmetic surgery following massive weight loss. Now, a lot of people nowadays have adopted a healthier lifestyle and they've changed their lifestyle to a point where a lot of weight is lost. It can be up to 50, 60 kilos, 100, 120 pounds. And I see that frequently by people who've had the will to lose it by themselves by exercising, eating less, and following strict diet plans. As long as it is done in a healthy manner and it is stable, one can think of improving their looks in other ways as well. The other people who kind of lose a lot of weight over the next year or two is people who have had bariatric surgery. For those people also, we want to do any procedure in terms of cosmetic surgery only after they have kept the weight loss off for about 1 year, so a stable weight loss. So once people have a stable weight, whether it's been done after having a massive weight loss following bariatric surgery, or if it has been done by their own will and passion for looking better and feeling better, the weight loss has to be stable. It should not be such that you have major procedures done for improving your looks in terms of getting rid of the loose skin and such, and then you gain the weight back. So it's important to know that any aesthetic or plastic surgery after massive weight loss should be done once the weight has been stabilized. So once you've lost all that you want to lose and you're not likely to gain any more, that is the time to think of post massive weight loss plastic surgery. Now, what does that mean? Why do people need it? The reason for needing post massive weight loss after bariatric surgery or by massive weight loss on your own, the reason for needing plastic surgery is because the excess skin and some subcutaneous tissues which have been deflated because of massive weight loss, they just kind of hang and are uncomfortable and somewhat unsightly when outside of clothes. You may not see them as much when in clothes because the bulk has been reduced, but they kind of hang down and they're uncomfortable and they're unsightly, so a lot of people want it to be done. So the first thing to do is for people who've lost a massive amount of weight, whichever means, and have kept it off, is to first congratulate them because it takes a lot of effort, a lot of doing to lose that much of weight. A lot of people can lose 5-10% of body weight, but to lose massive amounts of weight is not easy. Anyhow, so once people have lost a lot of weight and they come to us and say that, well, we have these loose hanging arms, we have this loose hanging skin on the face or neck, and we have most of all loose hanging skin on the abdomen, and our buttocks have kind of shrunk and become kind of droopy or loose. That's the time lots of us plastic surgeons see patients after massive weight loss. Now, the areas of concern usually are the following. First is the trunk. In the trunk, it is the abdomen, the stomach, which after massive weight loss just hangs down and folds either horizontally or vertically or both. The next is the lower back, and there also you have a lot of loose skin hanging down. The upper back, there as well you'll have loose skin and folds right in the middle part of the back, what we call subscapular folds. The third is the buttocks. The buttocks become deflated and they become saggy, and that people do not find very appealing. Now on the upper part of the chest, on the front side, the problem is the breasts, or in the males, the chest itself. It becomes, people who've had a lot of weight have a little bit of gynecomastia, which is enlargement of the breast. Now for them, as well as for ladies who have loose, droopy breasts after weight loss, some kind of procedure may benefit in getting the best aesthetic look for their transformed figure. So on the back you have these subscapular folds, on the front you have the chest or the breast which are loose and hanging, and then lower part you have the abdomen and the buttocks. That is as far as the trunk is concerned. Now in the legs you often have folds and loose skin in the thighs, both in the inner thighs and the outer thighs. And that can be fixed as well with some procedures. The calves are usually not a problem, but sometimes people find that their calves also look thinner because the muscles are left, but some of the layers of skin and fat that they have become loose and kind of droopy. Then we come to the arms. Very often the arms would have a lot of folds of skin coming down, hanging down, and people would will not be happy. They'll call it bat wings deformity and such other names. Coming to above that, the neck and the face can also have a lot of droop. Once people have lost the weight, just kind of hangs down. Even at a younger age, we're not talking of people who are older, but even younger people in the fourth decade, third decade, they can have a lot of loose hanging skin in the face and neck if they've lost a massive amount of weight, and that also their face and neck have suffered more than usual. A lot of younger people, the face doesn't hang down, the skin of the face does not hang down as much, nor the neck. Once people mature, then it does do that. But occasionally in the younger person also, you'll have this loose hanging skin, and that at that age may not be acceptable, cosmetically speaking. So let's first talk about what the procedures are and how they are done and so on and so forth. But the first thing I'm going to talk about is the procedures starting from the head and neck. The first thing with the face is the deflation of the subcutaneous fat, and the face goes down. I'm talking especially of people who are older, but again, as I said, some younger people can have it as well. So the first thing I do, especially for younger people, is try to replenish the volume by injecting some fat or fillers in the areas where they would look good. Not in the cheeks here, very unusual here, but most often in the upper part of the cheeks, sometimes in the hollows beneath the eye, and sometimes in the hollows in the temporal regions. That's the first thing. The second thing I do is using a non-surgical technique like invasive radiofrequency, thermitight, or some other means, face tight, to tighten the skin as much as possible without a cut. That is for younger people. For older people, I think most people need and want a face and neck lift, and that is a surgical procedure where you make a cut around here and then in the back, and sometimes tighten the muscles and then pull it all back, and you can have a nice tight look. And along with that, I usually do some fat injection to restore the volume again in the parts that that have really lost the volume and where the volume would look good, not everywhere. So that's for the face and neck. Then the next part is the chest. So on the chest, we are usually talking of the front part, and the front part in ladies, you have ptosis or drooping of the breast with deflation of the breast. For that, very often we have to do a lift as well as an augmentation, which means augmentation is usually through implants, sometimes through fat. Occasionally you will have someone who does not need augmentation even after the weight loss, their volume is sufficient. So there you do a breast lift, and rarely some part of a reduction can also be combined if the volume is still very high. The way the breast lift is done after massive weight loss is a little bit different from the person who's not had a massive weight loss and just has big breasts. When you do a post-bariatric or post-massive weight loss breast lift, you have to take into account the large amount of skin that has to be dealt with. Smaller procedures like a vertical scar only or just a circumareolar around the nipple technique, they do not work. What you have to do is a traditional wise pattern breast reduction, and one should try and preserve the deeper parts of the tissues, including the deeper part of skin and subcutaneous fat. That can add volume, and sometimes you don't need an augmentation just because you've added volume from the extra deeper parts of the skin and subcutaneous fat. When you need an implant is put in the same way through the same cuts, and it can be put behind the muscle if the volume is really depleted, or in front of the muscle if the volume is still adequate. And that means you should have at least 2 centimeters of breast tissue ahead of the implant. As far as the breast lift and breast augmentations are concerned, the other part is males, the chest droopiness. Sometimes the males who've had some gynecomastia or some enlargement of the breast tissue before the weight loss will have a droopiness of that, and the descent of the nipple and the areolar complex, and they too would need a breast lift or a reduction in the skin. Sometimes these breast procedures can be combined with removal of extra skin in the armpit area, and also take it towards the back to the folds that form in the upper back, which are called the subscapular folds. And these procedures are called upper body lift, which often include taking care of the arms as well, the loose hanging skin of the arms. That's called a brachioplasty. And when all of these are done in the upper body, you call it an upper body lift. Arms, when trunks and the arms are done together, they can all be done in one session, and you can have a pretty good looking upper part of the chest and the arms at the same time. As far as the arm lift goes, when it is not possible to do it non-surgically, and when I do it non-surgically, it is with thermitite or face tight or body tight, and when I do it surgically, I do it through multiple different incisions depending on what is needed. When there's just a little bit needed, I do it from just one small cut in the armpit. If you need a little bit more, then I do a T or L-shaped cut. If the entire skin is loose up to the elbow, which is often the case, I do a long cut like this. So depending on the extent of the loose skin and subcutaneous tissue, the extent of the length of the incision will depend on that. That is for the arms. For the upper chest, now going to the upper back, as I said, you could combine it with chest or the front side lift or the breast, and then you can carry that incision to the back. Sometimes the looseness is only in the back, and then you do just a subscapular lift or a bra line lift, which means there's a cut that is put in the bra line, and the entire loose skin and subcutaneous fat, they are removed. Then going on to the lower part of the body, which is the abdomen and the buttocks. For that, what we often do is called lower body lift or a belt lipectomy. What that means is that the entire circumference, like if you would call it a tire, like a tire, entire thing is taken off in a belt lipectomy. In a lower body lift, the same thing is done, but the additional thing that is done in a lower body lift is some undermining of tissues in the lateral part on the outside of the thigh, so that the thigh can be lifted from the outside part as well. So in a lower body lift, you do the abdomen, the lower back, the buttocks, but as well as the outer thigh lift. In a belt lipectomy, you would do the entire tire without trying to lift the thighs. Now the incisions are slightly different, but they're basically like a belt. They go all around. One more thing that is often combined with this is lifting of the mons or the privates. They often start hanging down when someone has lost a lot of weight, and the mons or the lower part, including the genitalia, are kind of lifted up, and they can be repaired at the same time. That can be done at the same time as a lower body lift and is often combined. Another thing that is done either with a lower body lift or separately is an inner thigh lift. An inner thigh lift is when you have loose hanging skin in the inner parts of the thigh. A long incision is made from the groin right up to the knee, and all the extra skin and subcutaneous tissue are removed and tightened. Occasionally for the calves, we do some calf implants, and that's about it. So for calves, you don't need much. Very rarely you do some fat grafting also, but most often you just need to do calf implants or nothing at all. As far as the safety of these procedures is concerned, the first thing one has to realize is that they're big procedures. There are a lot of safety concerns, and they have to be done very safely. Sometimes you need to add volume, and those are different procedures, just like for the face I had described. Sometimes the implants in the chest or the breasts, sometimes even a Brazilian buttock lift. But as far as tightening of the skin and removing the subcutaneous fat are considered, they have to be done carefully by people who are experienced in these procedures. Now, the lower body lift with the thigh lift is probably the most extensive cosmetic procedure that there is. It has to be done as an inpatient, and you need to probably stay in the hospital for a couple of days or more after the lower body lift. Now, lower body lift in its most extensive form includes the abdomen, the sides, the lower back, the buttocks, the inner thigh, the outer thigh, the mons, and sometimes even adding volume to the breast, like in a Brazilian buttock lift, or it can even be done by some of the skin that would have been removed before. The skin as a flap can be brought in, and it can be used to increase the volume of the buttocks. So in its most extensive form, it includes a bunch of procedures. I usually do it as an inpatient and keep the people who've had it done for 3 days after the procedure. The reason for that is because there are a lot of body changes that happen when you remove that much of skin and subcutaneous tissue, and sometimes add some volume. That careful monitoring is required for the first couple of days. The patients have to be well selected. You have to make sure that the heart is good, all the other parameters are good, all the other investigations are done. Make sure the heart, the lungs, especially after COVID, those are all in good condition, and the blood work is all good, and everything else. When that all looks good, you have had a medical clearance and an anesthesia clearance, one can go ahead with these procedures. Now the lower body lift, if you were to think of just, as I said, just removing the entire tire of loose tissue and bring the rest together, it would give you a good picture as to what is required. Occasionally you have to put in addition to the belt, the circular cut, I sometimes have to put a vertical cut to make sure that the tissues that are loose on the sides are also brought together. Some people prefer it to make it tighter. Some people say that I would be okay with a little bit of looseness on the sides, as long as I have the minimal cuts that can be well hidden in the underclothes, in an underwear or panties. So depending on the preference and how much is needed, we take a call on that. Now, lower body lift means removal of a lot of tissue, tightening of lots of tissues, sometimes a little augmentation of some tissues. The procedure takes usually between 4 and 6 hours, and that's kind of where I try not to combine anything else in the upper body when I do that, because when you combine too many procedures, the risks go up. The people have to be carefully monitored, and you have to do some DVT, deep vein thrombosis prophylaxis, because that's a big issue with this. That usually involves giving some low molecular weight heparin later on, and in the intraoperative and the postoperative time, I always put people on those venous pumps, which are like stockings that go up and down and keep compressing your vessels. As soon as people can get up and walk, which is usually the first postoperative day, I make sure that they start walking, maybe just a few steps in the room itself, or perhaps just to the bathroom. So that does a lot in terms of keeping you safe from deep vein thrombosis. From the first day or after 12 hours of the procedure, I start people on a low molecular weight heparin injection, which is quite safe and prevents any clots in the legs from forming and going up any way they can. So that is one of the main concerns after surgery, that you don't have a deep vein thrombosis. Some chest physiotherapy is needed after doing such a massive procedure, and usually some drains are put in so that all the fluid that accumulates in these tissues can come out. Most people feel good enough to go back to their homes or their hotels after 3 days, and after 2 days all the sutures are usually taken out, or the 15th day all the stitches and sutures are removed and people are made mobile. Also a garment is put which is to keep the tissues supported, and also it helps in decreasing the amount of swelling after the procedure. So and we always do antibiotic prophylaxis, and pain has to be controlled. We often give either a pain pump, or we give some patches which would release a small amount of medication slowly to keep the pain at bay. Sometimes I even have patients have post-operative analgesia with an epidural catheter, and that we keep for a couple of days so that some medication can be infiltrated directly into the nerves through the epidural anesthesia catheter. Now, the pain, the infection, the deep vein thrombosis are things which can be helped, and the incidence of those can be minimized as long as precautions are taken, and the pain itself can be fairly well controlled with the measures I've described. Post-operative garments are not absolutely essential, but they do help, so I advise everyone to put them on. And even for the legs, I usually recommend people to have some stockings on to keep some compression on their legs as well. Usual time for taking the stitches out is the 14th or 15th day, but some of the infection can show up in about a week or so. So it's important to be seen by the physician or the surgeon who's involved with your care. You need to see him or her every few days after this massive procedure. The follow-ups usually after 2 weeks or 2.5 weeks can be done after 6 weeks, and then at progressive intervals after that. Very often people who have come from a distance from another state or outside, I usually ask them to share their pictures every week or so to make sure that everything is going well. Very often I would ask people to put some ointments to help with the scarring, as well as some silicone scar strips or silicone gel strips. Minimize the scarring, and people feel so good after having having all those loose hanging tissues gone, that they take pretty good care of their scars themselves and end up looking very good. Any other questions, concerns, or just doubts about the procedures, be free to call us or contact us through email and through any social media links that are given below. Thank you.